Feeling Step to Wellness. I'm Dr. J,
And I'm May.
your trusted guide to whole person health, one step.
And one bite at a time.
Today, we have the distinct honor to talk to Dr. Bobby Mukamala. Um, Dr. Mukamala is a board certified head and neck surgeon and the 180th president of the American Medical Association. He started his term in June 2025. He is the first physician of Indian origin to lead the AMA, marking a historical milestone in U.S. medical leadership. And based in Flint, Michigan, Dr. Mukamala has been in private practice since 2000. I think that's another special feature of this presidency. And he has been actively involved in AMA since his residency. I think that Dr. Mukamala has a very, very long bio. We want to save some time. But another thing I want to highlight is Dr. Mukamala is also the first lifestyle medicine board certified physician to lead AMA. I think that is the thing we really want to delve into.
Yes.
Nice to be here with you both. Thank you very much. It's a nice reunion in my mind, seeing you guys again.
Thank you.
Well, Dr. Mukamala, we had a pleasure to have you present at our 8th annual conference at the, for Lotus House Foundation about close to 3 weeks ago. And as a keynote at our conference, you also deliver a beautiful, inspiring presentation at a Mayo Clinic grant round. Both topics is about related to lifestyle medicine, and one is focused on the clinical practice, and one really focused on the community. So today, we would like to dive further about the preventive care. We want to help people live a vibrant, healthy life as a longevity. And so first of all, we would like to invite you to give our audience a reflection on your attendance at our conference. And what do you think about it?
It was an amazing experience. I mean, this year as president of the American Medical Association, obviously there's a lot going on in the healthcare system. And so many places that I go, I talk about all the work that the American Medical Association is doing to improve the healthcare system. And the range of those topics is everything from keeping physicians happy practicing medicine so they don't burn out, to dealing with disease in our country, to dealing with compensation for taking care of patients, and the electronic health record. And so it's the whole book. And yet, when I came to be with you guys and in that meeting, it was so focused on something that I'm passionate about, and obviously you guys are passionate about. And the room was full of people with that same passion about living healthier lives, living longer lives, not under the burden of a chronic disease. I mean, it's amazing what happens at the Mayo Clinic, right down from where we were meeting to keep people alive, like myself. I mean, I had my own healthcare issues that we'll probably dive into a little bit, but surviving disease is wonderful, but it shouldn't be the only focus of what we do, right? We should invest adequately, at least as much, if not more, into prevention of disease, living longer, healthier lives instead of longer lives with chronic disease. So that's something that, again, I think all of us are passionate about. Everybody in that room was passionate about. And it's just one of those meetings that, of all the places that I go, you can just see the distress, the frustration, and some things that we talk about, the faces in the audience get red, with anger, but not in this room. I mean, this was a room, and I've had that happen before, right? When I presented at the national conferences on lifestyle medicine, just the joy in that room, the positivity in that room, I don't think is by accident.
No.
And it's our own biology, it's our own health that creates that happiness and satisfaction and excitement, as opposed to drama. And so I suppose if this was when we used to have those videotape stores and they had them categorized by like comedy and drama and happy, like these meetings would be in the happy column, not the drama column for the movies, which is wonderful.
Yeah, well said. And I know that what you say really is a reflection of Dr. J and I when first attended the American College of Lifestyle Medicine Conference 2014. And that was the first time kind of have the this lifestyle medicine curtain open in front of us and to feel a hope of the health in this country. And we too believe and would firmly that we found the answer, as what you just described. We found attendees. Most of them are the healthcare providers at all kinds of a specialty, and they were so happy and so vibrant, and you can sense that energy, the happiness, and that is just a reason continue to attract us going back for 10 years in a row. So this is the kind of a work that we feel like is truly tireless and it's rewarding.
Yeah, think about it. You brought up another way to think about this is that there are some things that are contagious that we don't want, right? Like
Yeah,
a COVID virus.
yeah.
But happiness is also contagious. And I don't think we ever think about it that way, or we don't think about it that way enough. Uh, but but satisfaction and happiness with our careers as healthcare workers, with human beings,
Hmm.
is something that is contagious in a good way. The
Hmm.
more
Yeah.
we
Yeah,
catch
yeah.
that, the better.
But I think that there's one issue about the happiness in among physicians, providers, is we love lifestyle medicine. But as you know, in private practice, reimbursement is a big part of our practice. How do we make lifestyle medicine practice enjoyable? Now, while we're delivering this healthcare philosophy to our patient to make them more vibrant, healthy, because lifestyle medicine practice takes a long time. We want to talk to the patient, we want to educate them, empower them, and they have to trust us before they will really tell us their stories. It takes a long time.
Hmm.
But in healthcare, in health insurance, talk is really cheap. Uh, that you can talk an hour, but you get paid less than doing the small procedures.
Yep.
So how do you think that we will be able to make it sustainable for the providers, physicians to really use a lifestyle medicine approach on their practice?
Yeah, I think you made a great comment there, Dr. Jane. That is that, when we're in the patient room, period, whether or not it's spending the half hour necessary to talk about how much sleep they're getting and what their exercise ability is and what their neighborhood is like to be able to go for a walk, uh, or to talk to them in depth about the consequence of that. So not just the prevention of disease, but any conversation, even when they have disease. When I diagnose somebody with oropharyngeal cancer, right, that's something that when I'm spending that time with them in the room, that's critical.
Hmm.
But yet the system doesn't support that at all, right? And like you said, that just the economics of it, that's a wonderful use of my time, and I'm happy to do that. But when I come out because of something like the shortage of physicians in Flint, Michigan, right? My office, and it's a little bit different now because I'm president of the AMA and I traveled for 200 days this year. But usually my patient next available appointment is 2 weeks out,
Mm-hmm.
right? But they're waiting for a long time. Sometimes other physicians, it's months out. And so when you have people waiting, it's almost more pressure to get people turned over faster in the office so they don't have to wait as long. And that's just to keep patient care at a high quality by not making them wait to have their oropharyngeal lesion checked out to make sure it's nothing bad. But on top of that, on top of the physician shortage, the compensation method from insurance companies, from the coverage that people have, doesn't support that either. Right? Our overhead to manage our offices, to take care of our patients, has gone nothing but up. I've been in practice for 26 years. I mean, the employees that my wife and I have in our office back in the year 2000, 10, 11, 12 bucks an hour. Now it's double that, right? That's normal. But yet the compensation from an insurance company to be able to take care of the patients in the way that we want and spend the time that we want is not there. And so this is something that the AMA, and I'm proud to be president of the American Medical Association, because this is exactly the message that we give to those that are in charge. right? That help to create a system that's better for our patients' health and better for the physician satisfaction, so we don't burn out, right? I don't mind working until the sun sets, as long as it's between me and my patient,
Mm.
as long as necessary to keep them healthy and to treat their disease if it does happen, than dealing with all of the time I spend in front of the computer or talking to my office staff about something like prior authorization, to do the right thing. That's where I
Right.
don't want to spend my time. And
Right.
so that's exactly what we work on.
Right.
Right,
Right.
especially the deny claims,
Mm-hmm.
kickbacks. You have to fight all those. It just waste of the time, everybody's
Mm-hmm.
time. Yeah.
Yep,
Mm-hmm. Mm-hmm.
absolutely.
And I think that kind of that is the ugly part of the practicing medicine, especially for private pay. No, the private practice, because of the smaller team, and we as a provider we have to wear multiple hats. To how to keep our door open, but also what can we do to do the best treatment for our patient. A lot of time, they just wanna be their provider to listen to them because they wanna be heard. So at a conference, you also pinpoint one thing that really resonate with me. Like we have to do more than um, the exam room. The preventive care has a lot more. We have a lot more work to do beyond the exam room. So, which means that it related to the community health and how you bring that to the community level to embrace the preventive care. So, what is your ideal community-based initiative to accomplish this goal?
Yes, no, I think that that's a wonderful thing that you remembered from my comments, because it's something that I say a lot when I talk to those that have an influence on healthcare. And that is that even if we did get 30 minutes per patient to talk about everything that we could in that moment about their health, that is just this moment in time
Mhm,
Mhm.
compared to everything that led to that appointment and then what they do after they leave,
mhm,
right? And so to think that in these 30 minutes, we're going to fix their health and maximize their health in a good way for their life or till the next appointment is very foolish, right? It's very naive because there's so many factors that affect their health. And what
mhm,
we need to know and what they need to have access to are those things that can improve their health.
mhm,
Basics of that, right? The most basic, access to healthy food. I
mhm,
come from Flint, Michigan. This is where my parents immigrated from India. I grew up there. Now Nita and I have our medical practice in Flint, Michigan. It is not Beverly Hills.
mhm,
It's not a fancy place to be, especially in the city where
Mhm.
Nita and I live. Right? Life expectancy in our city where we live is 68 years.
wow.
Mhm.
In the suburban part of Flint, Michigan, where my parents live, where I grew up in the suburbs, 81 years. Right?
Right.
Mm,
And so massive difference. And so many people think, oh, you must be thinking about 1960 versus 2026. No, this is the data within 2026. Right? And so these are the things that are affected not by the 30-minute appointment, but the
Mhm.
entire neighborhood from the access to healthy foods,
mhm,
right? Which is one of the main principles of lifestyle medicine, but also a place to exercise.
Mhm.
We
mhm,
can talk to our patients about exercise. They will know the number of minutes they should do and what sort of activity they should
mhm,
do. That's what we got
mhm,
board certified to talk about.
mhm,
But what use is that when the moment they go home,
mhm.
especially in, I mean, there's the weather issue anyway, right? So
Right.
of us live in the Midwest. In January, by the time you're done with dinner, it's dark out. And
Mhm,
so, what is your ability to do that? Now, there's a lot of people that if the neighborhood had lighting,
Mhm.
right? If you could take a walk, if you had clothes to wear to be able to deal with the cold temperature, when you do that, when we're comfortable, it's a beautiful time to walk. When there's a white coating on everything and it's just you can see the stars in the sky, even in winter, it would be a totally doable, totally enjoyable exercise. But in Flint, Michigan, besides all the natural consequences of winter. There's no lighting, right? We have parks that used to be beautiful almost, 50, 60 years ago, but not anymore, right? They're dangerous places to go. And so that's just not a system where this 30 minutes is going to have an impact on anything when they're coming in with a headwind and they're leaving with a headwind. And so these are the things that are important to advocate for. Knowing the right thing to do, but being able to do it are very different. So how do we do that? That's when we get the community engaged, right? So whether it's the Chamber of Commerce that makes an investment in this for the community, right? The business owners see value in having the neighborhoods be safe and healthy and motivate people to be healthy, right? The healthcare system, that's obviously our collective responsibility. We as individual physicians can't do that. But there's a lot of players in the healthcare system, from insurance companies to massive hospital systems, right, to pharmaceutical companies, right? I mean, just the whole concept of the reflexive answer of the pharmaceutical company to, the question of, you have this condition, which pill of ours can help you, right? That's so limited in its focus, right? But to have an industry like that contribute to prevention of disease is unheard of, but it doesn't have to be that way. And, law enforcement, make it a safe place in a neighborhood like mine. Uh, and so those are the kind of things that make it so it's not dependent on this 30 minutes, but has the support of everything before and after. That's how we become healthier.
Well, that's a lot of things inside there. So, and that was one of the reasons we started out the nonprofit arm of Rochester County, the Lotus Health Foundation, because we just cannot look at one patient at a time. Not only insurance, but our time-wise, it's just not feasible for us to do that. And that's why we started up this nonprofit, and we have this community awareness symposium and gala to bring speakers in and talk to the community, to educate the community. And May and I also do a lot of community education activities, like we monthly interview on TV, talk about presentation, cooking demo. In our 125 Live, our senior center, we have the monthly presentation cooking demo. And we also had a monthly plant-based cooking at the Ronald McDonald House. It's Ronald McDonald House, but no burgers there. But so what do you think that how do we can put this one step further to educate the community members, and so they can take one small step at a time to start this journey?
Yes, I think that there's a lot of opportunities there, right? Some questions like this, you would think, oh my gosh, where are we going to start? But you guys have proven that there are places to start to actually have an impact. And it's not, I don't think it should be done sequentially. Like, we'll try this first, and then we'll do this, and then we'll do this, because you're waiting for all these things. These things can be done in parallel, right? Everything from a school system, right, that's talking to the kids about this, to the after-school programs. What's amazing about my life is that I'm from Flint, Michigan. We have something called the Charles Stewart Mott Foundation. Charles Stewart Mott was one of the early suppliers of General Motors when General Motors first started in the 1920s. And he's left a foundation where much of the focus of the grants that are made, almost like 40% of the grants that go worldwide, stay in Flint. And one of their major accomplishments across the country is after school programs. This is what they fund from coast to coast and even internationally. And this makes the school a place where it's not just for students, but parents, adults come to pursue everything from a hobby to potentially a business line that they might want to go into this business. But that's exactly where we can talk about these things, right? And so you plant these seeds in these minds, whether it's the kids, whether it's the adults in an after-school program. Again, Chamber of Commerce, hospital systems. It's one thing to cure a disease or to control something like diabetes that has a flare-up, but how about spending quality time after the patient is discharged to prevent the readmission? Just the basics. And our infrastructure in healthcare really doesn't support that, and it should. And so these are the kind of things that, there's a lot of communities like mine. We have universities in my hometown
Mm-hmm.
We have three universities. And so this is also a place where our communities can get smarter, right? Pursue exciting hobbies and interest. We have a farmers market that's amazing.
Mm-hmm.
Right? It used to be, when we used to have newspapers that were printed, but now they're all digital.
Yeah.
What do you do with a big building, right? It's
Yeah.
still useful, but not to print a newspaper.
Mm-hmm.
And so now that building is where our farmers market is,
Mm.
right? Where people can come and have access to healthy foods. There's a kitchen in the farmers market where if you want to have a class and a
Mm-hmm.
bunch of people are learning at the same time about, oh, how to make this dish. It's one thing to see it online and to have the ingredients listed or to have a book. It's another thing to engage in the social experience of doing that with other people in our community, right? Where they're smiling and laughing and you mess something up and instead of throwing it in the trash, people laugh at you and it becomes a joke. And that's the fun part of learning these things, right? It doesn't have to be purely academic.
Mm-hmm.
It can be exciting. It can be fun. And so this is the role that the community plays. And so, like I said, I'm thankful to have something like the Charles Stewart Mott Foundation. You guys have that there also. The public interest and the public support of that. But this needs to be a pleasantly contagious thing.
Mm-hmm. Yeah. Um, one thing that you mentioned about the hospital, uh, as a AMA person, this is not this is just a kind of pop in my head. Um, how beside setting, kind of discussing some of the nutrition related policy, how do you see the hospital food that how we make sure the hospital food that feed to the patient, especially hospitalized, are they truly a healing food instead of the food that caused them into the hospital?
Yeah. No, I mean it's so important. It's funny that you have that question because a lot of the interaction I have nowadays, because this is my passion, this is our passion, to preserve our health,
Mm-hmm.
is an intersection with the Department of Health and Human Services, right? And Secretary Kennedy, and this is something that he's also very interested in, and that is if we're going to serve food at a place like a school,
Mm.
like a
Mm-hmm.
hospital, it shouldn't just be, okay, what do we get the biggest discount in from our food supplier? What's the cheapest way to do it? Everyone sort of has this tendency to think that to serve healthy food is going to be so expensive we can't do it.
Mm-hmm. Mm-hmm.
We know that's not the case.
No.
We have all sorts of data about that.
Mm-hmm.
But when the bias in the culture it leads you to that default theory that it's going to be expensive, we can't do it. We're going to stick to this, highly fat, high salt, lots of oil, lots of preservatives, things like that. That's the default answer, but it shouldn't be that way. And so there's this whole concept of anything where there's a carrot and there's a stick.
Yeah.
Yeah.
So the carrot is sort of exciting people and saying, hey, help them solve this problem. So they're serving healthy food. The
Mm-hmm.
stick is, of course, to not get financial support if you don't do this. Right. And so there's two ways to do it, and people have different philosophies about it. But both of them bring attention to a problem that can be solved as long as we focus on it, as opposed to just being a default order for this supplier to bring in this food, which is how things tend to be.
Well, I think hospital is a different situation than school.
Mhm.
A few years ago, I had the misfortune of staying in the hospital for one night. And I was told that I had to pay for the dinner myself. I was very surprised by that. But then when I look at the menu, I'm basically like, there's no way I'm paying for this. Actually, I just won't go away and may deliver me dinner. But
Yeah.
that is more different from school because school, they follow the USDA guideline.
Yes.
And that is totally different from the hospital that they have more their autonomy to purchase. So
Yep.
how do we deal with the school when the school still provides those processed meat, even though back in 2017, I think World Health Organization has classified processed meat as Category 1 carcinogen, and we're still doing that, and we're still subsidize those type of food. How do we deal with that?
Yeah, I mean, so clearly these rules need revision, right, and updates. And this is exactly what I mean. whether you call it Make America Healthy Again, or whether you call it improving the lifestyle of everybody, those are just different ways to phrase that major component of our preservation of good health is what we eat. And there shouldn't be ways to get around that when there is regulation. Like you said, schools should be the easiest place because they have to follow a protocol.
Mm.
But if the protocol allows this and that, it needs to be revised. And I think that's the attention that it's getting now. And there's different, levels to what's easy and what's difficult. In fact, in a meeting I just recently had, to have something, there's ultra processed foods that can be a challenge, right? I mean,
Yes.
there's so much that's not good for you. Very rarely do you have a component that actually has something in it that is useful. So not all processing is bad, but I would say the majority is bad. And so to be able to do that within these rules means that the rules need to be revised. So that's no longer a risk. And that's exactly what the current administration is focused on.
Yeah, May and I were on your webinar about the
Yesterday.
ultra processed food. And I think that issue is not just they are bad for your health, but also they make you addicted to it.
Yes.
So that is a tricky part over there.
Yeah, that's some creative slash sinful marketing.
Yeah.
I mean, it's one thing if you like it naturally and you're like, oh man, I really like that. It's another thing if you're chemically induced. It's almost like somebody hypnotized you.
Mm.
So it's not your normal brain function. You're hypnotized to say, oh, I got to have more of that. That's a problem. That's not right.
So I want to acknowledge your effort in making those health serious through AMA, because this message need to be heard by the general public as well, because they don't know what does it mean by ultra processed food or highly processed food. And then that, even though we thought that we know that, but still there are different level of processed food. So, and as you aware of that, a lot of people came to the conference 2 weeks ago from the majority of folks are community members, and people just are so eager to know what can I do in my community, and you put a very simple suggestion. Say, start from small. Start from ourselves, our family, community, and then further out. So you also mentioned about you have an initiative, actually invite the local high school students to do the blood pressure measurement at a farmer's market. That to me is kind of a win-win for multiple party. One is you actually take that opportunity to educate the youth. Number two, you actually kind of help people, like they encourage them to go to farmers market and then take that opportunity to educate them. So you want to share more about this? Is something so simple that we can do, especially the good weather is coming.
Yes, for sure. I guess the one step backwards in your question is that it's one thing to sort of educate the community, but we as healthcare workers also need some education
Yes.
about the value of nutrition. It shouldn't be something that we assume that, I learned this in medical school. We just need to get this information out there. We need to get that information into our own head. Because, one of the things that really uh, shocked me to remember and then realize what's still going on, the amount of time that I had as far as diet nutrition in the classroom at the University of Michigan. I was the class of 1995, was maybe an hour and a half in the entire M1 and M2 experience, which was classroom based, and certainly nothing in M3 and M4. And so then I was curious about what's it like now. It must be better. It's not, right? One of my roommates, his son is a second year medical student. And so I reached out to him, I texted him, I was like, hey, how much of this did you get? 2 hours, right? And this is at an Ivy League school, right? And so it's not just conveying our knowledge to our patients. When we ourselves lack that knowledge, it is not going to do much good, even if we had the time. And so that's why I think that it's important to add that to the curriculum. And that's what the That's what the American Medical Association said. We will take responsibility for that, right? In the dietary guideline revision. This is what we said to the lawmakers, right? To HHS, to Secretary Kennedy. This is our responsibility, right? Including those that are involved in medical education and in postgraduate training and graduate medical education to make this part of that knowledge. And then, the interaction that we have with our patients, right? To be able to make them excited about improving their health. Like you said, just setting some high school kids outside of our farmers market just to help people know what their blood pressure is without having to wait for a doctor's appointment. And it was amazing, exciting, and disappointing all at the same time, right? It was amazing to have high school students in what's called the HOSA program, the Health Occupation Student Association, people that wanted to go into healthcare. And they're sitting out there, and we set up a table, and we got these certified blood pressure cuffs, which is, again, a big passion of the American Medical Association, to screen for blood pressure, to help people do it on their own, not with some random blood pressure cuff that you found online, but something that has actually been proven to be accurate, right? And there's an AMA resource to find those. But to use that and then see what people's blood pressure is, let them know. So everything from teaching a future physician to helping the community. And what was disappointing about that, 25% of the people that we just screened their blood pressure randomly had stage 1 hypertension and had no idea, right? And the default is, oh, I was just nervous, right? And we know it. We call that the white coat syndrome, right? Yeah. But we didn't have white coats on. We were dressed like this, in like t-shirts and shorts. So that excuse doesn't apply. There's nothing anxiety provoking about sitting on a beautiful day in Flint, Michigan at a table outside with some fun kids testing for blood pressure. If anything, that should give you the most relaxed feeling. And yet 25% had stage 1 hypertension and didn't even know it.
Wow.
And so it was also a wonderful place, and if we had more time and I had more knowledge at the time, we could convey that knowledge. Not just would we say, you know what, you have stage 1 hypertension, you should see your doctor. The sentence should have been, hey, you have stage 1 hypertension. There's these lots of things that cause it, including diet and nutrition. What were you planning on buying when you go into the farmer's market?
Smart.
Simple question.
Yes.
And then all of a sudden they're thinking, I was going to get that, but what do you think about that? All of a sudden, my lifestyle medicine board certification comes in really handy.
Yeah.
And kind of what you said is that a lot of my colleagues that are curious about lifestyle medicine, it starts with their own health,
Yes.
which I think is totally fine.
Yeah.
Interestingly, mine was more about just exploring it to see how it could help us take care of the health of our country. I mean, I was president-elect of the AMA at the time. And so for me, it was more about how is this going to help our country? But it's totally normal. In fact, maybe even the majority reason about how is it going to help me? And I think that's either way, we get there.
Yeah, I can understand that you are very passionate about community. So one comment I got from several attendees of our symposium was they were very surprised to see you stay after your keynote speech. And I had people coming to me and say, I shook hands with the president of AMA.
Yeah.
Oh,
yeah. You were the superstar that day. And people just brag about it. Yeah.
I don't know about that. When I love talking to people. That's what excites me, right? And so even yesterday, I gave grand rounds in Detroit to the ophthalmology programs, all the Southeast Michigan residency programs. And then I finished, and I had to get on a flight this morning at 6 a.m. I didn't get home till 11 p.m. because there were so many wonderful conversations to have. I mean, there is value in me putting up the slides and the PowerPoint and having that conversation, answering 15 minutes of questions. But if I leave at that point, that's like, it's a very academic experience without the social experience. And I think there's just so much more that you would talk to with somebody when it's not a one-on-one thing with a microphone and 100 people listening, right? There's obviously that silencing effect of that kind of drama. But when you take the drama out and it's a purely social conversation, just with 2 people and nobody else listening, it's so much more productive. So yeah, I don't leave until they turn the lights out.
So,
Oh, I also, well, by the way, that's the reason you still replied to our email last night so late.
but
Thank you.
I want to switch the gear a little bit from what you said that you explore the lifestyle medicine board certification, not just for the organization, for the country, but also for your own health. And when we look at the corporate influence a lot of insurance premiums. They have a lot of employees. So I really want to see how AMA is working on you improve executive health. Those leaders, they need to be the role model of their employees, but they also need to have their own good health, current health and physical health to maintain the good business. So is there anything the AMA is doing for the corporate health?
Yeah, I mean, I think that it's not a program that we have. Like we have this program in Chicago. We do a lot of things by leading by example. And so we have a program that's called West Side United, and it's beyond this the appointment visit that doctors have, but again, everything that leads up to it and afterwards. So West Side United is a collaboration with Rush University in Chicago on the West Side, which is the most challenged side, to look at that kind of approach. What else can we do to improve health? And so I think your question is about for those people that are leaders of the business sector in our communities, right? Like the chambers of commerce. How do we prove to them what can we do so that they can one see the value in this by improving their own health, that then also then the next step is logically to say, wow, if I'm healthier, I'm more productive. And then the millisecond later, they're like, wow, what if I had more employees that were productive, that were
Mm,
healthier, that are having to miss less work by going to an appointment for a flare up of a chronic disease or the development of a stage 2 hypertension from their stage 1 hypertension? It's worth the investment. And so that's something that we've done in Flint in a little bit different way than just nutritious food, but a healthy way of being, right? So we have a program in our Crim Fitness Foundation that is about physical health and nutrition was what it's been about for decades, the standard sort of approach to improving health. But now we've added mindfulness, right? So we
mm,
have a mindfulness committee of the Crim Fitness Foundation where it's not just physical health, it's mental health. And so that's something I have the luxury to chair. And it's something that we do in everything from the classroom, where K through 8, they start their class with a mindful moment. You know, in the East, we call it meditation. Here, we call it mindfulness, but it's the same thing. It's just a moment of reflection and silence and looking at seeing what my body is doing, right? Getting it relaxed to start the class day in school without worrying about the drama that happened the night before, right? Whether that was an ambulance, a fire engine, a gunshot, people yelling. It's important to just check that at the door so you get the best out of your school. And it's not just limited to school. So the entire healthcare sector, we have hospital systems that are now for the employees doing that. We have for-profit companies from the Chamber of Commerce that see the value in the good mental health of their workforce. And so again, it's something that's catching on.
Perhaps the next time we should have a topic focused on a corporate wellness to encourage those business leaders to lead the way.
Yeah.
Yeah.
You know, what's funny is that there's some things that are philosophically the right answer, right? And you can easily see that everything we've talked about is the right thing for a corporate entity to do
Mm-hmm.
based on the philosophy.
Mm-hmm.
But you know how it is. There's some people that it's the financial consequence that then defines what somebody should do or what they shouldn't do, what a company should do and what it shouldn't do. And even from that perspective, when you have healthier workforce,
Mm-hmm.
mm.
your economic consequence is going to be good. The finances, you know, the productivity is going to be better. So whether or not it's a moral motivation or
Mm.
whether or not it's a numerical motivation, both will come to the same conclusion, right? Which is
Right.
wonderful. That's rare.
Mm-hmm.
I think the one challenge that you mentioned about the financial aspect, that's if they want to ask them to start up any lifestyle medicine program, but it takes time. You may not see the drop in their insurance premium until maybe 2, 3 years later.
Yeah.
And it takes a great leader to say, we really need to do it, even though the first 1 or 2 years we have to spend money initiating doing these startup programs. So it really takes a great leader to do that.
However,
Yeah, but one thing I would say though, Dr. J, is that we remember from our board exam, right? One of the things that was amazing to read in the prep for my board exam was that this isn't something that you have to wait 2 years for. Some
that's
things
right.
naturally you do, but
That's right.
literally within weeks,
Mhm.
you
Yeah.
see the benefit, right?
Yeah.
With this metric or that metric.
Yeah.
So that's what I would say to the Chamber of Commerce. Yes, this is an investment. Some of that
Mhm.
investment, it's like, when you look at the financial consequences of your stock investments, you
Mhm.
can see what happened in a month, and then you
Yeah.
can see what happened over 5 years. But you get gains on that
Mhm.
investment within a month. It's not something you have to wait years to do. And so I think that's important to share.
However, allow me to inject something about a finance. Actually, if you look at most of a corporate, they already invest money on the wellness, but
Mhm.
whether take the to review what they doing in
Yeah.
terms of a wellness program, whether that is effective or not, and then kind of modify that to a lifestyle approach that can be more effective.
Mhm.
So I think one thing I do identify most commonly you adopt it is okay. The company provide the incentive, but you go to gym, you go to have a telehealth, but quite frankly, how many people really use
Mhm.
those benefit, right? So
Yeah.
just like Dr. McConnell, like you mentioned, if it's easy to change a person's lifestyle behavior, like for the physician to put a prescription, go exercise 30 minutes a day, and then do eat healthy. I mean, we won't have this chronic disease concern. It shouldn't be we call it an epidemic issue, but it doesn't work because, like you mentioned before, it takes some effort for somebody to start somewhere and to build a habit. So there's a room, but not necessarily hurt the bottom line financially.
And also remember that some corporate asking us to do biometrics for them. But then they say, how do you charge so your charge is so high? I could have a grocery store coming to do a finger prick. But the issue is that they just want to provide a program for providing a program for say per se, not really dig into how accurate it is, whether there's any follow up based on the results. So
Yeah.
that's another aspect of the corporate.
Yeah, no, I think it shouldn't be a checkbox thing, right? It
Yeah.
shouldn't be a trendy thing that they say, you know what? Yeah, we have an interest in this. Let's call them. Let's give them this app. Let's give them this discount. Let's give them this coverage. We can check the
Yeah.
box and move on to something else, right? And so this is again the American Medical Association when it comes to the place where physicians work, right? These institutions where we work, we have something called our Joy in Medicine program,
Mhm.
where we're assessing what is it like to practice in your facility, right? In your program, in the services you provide to your community. The doctors that come, are you doing the things that keep them from burning out? And
Mhm.
it's not just a checklist like, oh yeah, okay, we did this and we're done. It's something that needs to be continued. And so we give people recognitions.
Mhm.
The groups in the facilities of bronze, silver, and gold, right? A recognition by the Joint Medicine Program. And that doesn't happen because they check the box. This is what we've done. Okay, congratulations. Here's your award and move on. It's more like this is what we're doing
Mhm.
that's going to continue. So yes, exactly the same analogy is it's not just a checkbox thing. It's something that changes the way we continue to do things.
Mhm. I know that I'm watching the time, your precious time here. One thing I know that we still have a lot of things that we can on and on ongoing for further great discussion. But one thing I do want to bring it out to the public is you have your health transformation and because of it, your personal experience and you spend your precious time to make the significant impact to the health system in this nation, in your community. Would you like to share something about that? So we want to encourage people really think outside, bigger than themselves, and so we can put the effort together for the best health of everybody.
Yes, no, I love the way you said that. And yes, my personal health experience really informed and increased my passion for that. I mean, that's something that academically, I would say, even so, when I was a trained physician, that was what I would say is the answer. But there's a difference between knowing the answer and being passionate about that answer. And that change happened to me when I became a patient, right? When I was somebody that had to navigate the system, not for our patients, but being a patient. And so I got diagnosed with a brain tumor in November of 24, so about a year and a half ago, grade 2 astrocytoma. And that was my first trip to where you guys are, right, in Rochester, Minnesota, because at the Mayo Clinic was where I had my operation. And it was done with an awake craniotomy and awake operation. So all the science part of it, which we know, but then realizing the access that I had to care that was so unique
Mhm.
compared to my neighbors and most of the rest of the people in this country, right? So a health system that worked well for me to some extent. There's also challenges with high deductibles and high pharmaceutical costs. Just a quick example, the pill that I take for my own brain tumor problem costs $900 per day, right? Almost $250,000 a year. So yes, there's a lot of challenges. But what it motivated me to do as somebody that had the privilege of being in this healthcare system is to be more passionate, not just the academic answer of what we need to do, but why we need to do it. So more people have access to that care like I did. And so, the other funny story, I got diagnosed with that brain tumor. I was supposed to actually come to the Mayo Clinic to do a grand rounds in January, but in November, the surgery happened. So I had to postpone. I came 3 months later. But right after diagnosis was the day it was Saturday that I was supposed to go to a testing center and do my board certification exam for lifestyle medicine. And my whole family started to say, why do you want to go and do that? There's so much more important stuff going on. You just got diagnosed with a brain tumor. Who knows how long you're going to live, what that surgery is going to be like. Just forget about those boards. And so I was thinking, well, should I go? Should I not go? And it was Thanksgiving weekend. So all my friends came in out of sympathy for me, right? People I haven't seen in years are coming to be empathetic because their best friend just got a brain tumor. And it was a holiday weekend, so they all had some wine with dinner, and they were a little bit, feeling pretty good, a little too good. And so they slept in on Saturday. So all my friends are sleeping. I was the only one that was awake. So I was like, you know what? What am I going to do for the next 3 hours? I might as well go take this exam. So I went to this testing center and I took my lifestyle medicine board certification exam, and miraculously I passed. But it was just a funny story about how I pursued this because philosophically it was a good direction to go. My intersection with the healthcare system versus everybody else's. Now I have more knowledge to improve the health of the country as president of the AMA, while all my friends slept in because of what they had for dinner and drinks the night before.
Well, I the funny thing is, I mentioned that I was hospitalized for 1 day a few years ago. There was a few weeks before my last medicine board certification exam. And, and the board said, well, we're more than happy to postpone your exam to next year. I said, well, give me 2 weeks, I'll think about it. And then 2 weeks later, they say, I'm going to take it. They're just like, are you sure? I said, yeah, I'm going to take it.
Yeah,
Yeah, but
we're in the same club. I'm happy to be in your club.
not a good club to join, but yeah,
Well, it worked out well. It worked
Uh,
out well for we're
yeah,
smarter because of it.
there's a reason for that,
yeah,
right?
we're more
Yeah,
passionate about that. So,
yeah.
as you mentioned that you have 1 month left as a president of the AMA. So, looking ahead, what are your plans continue to promote lifestyle medicine
Mhm.
and also the community health?
Yeah, I mean, it's exciting. I mean, to go from being president of the AMA for our complicated healthcare system and all the things that we have to do to improve it, to now not having to cover 10 things in my speeches, but instead maybe one or two, right?
Mhm.
Access to care when you have a brain tumor, preservation of health with the principles of lifestyle medicine.
Mhm.
I'm looking forward to narrowing my talk to 45 minutes to an hour about one or both of those things
Mm.
instead of 10 minutes each for 6 of them.
Mhm.
Right? So I'm excited.
Well, if you need a cooking demo to partner with your speech, let us know.
Oh yeah, that's a tempting offer because I remember the amazing lunch I had right before my talk when I was with you guys. You guys are good in the kitchen.
Oh, thank you.
Uh,
Oh, Mel cook. I'm just there to eat.
uh,
Somebody
well,
has to taste test it.
Yes.
well, it's a pleasure to have you spend this fantastic time with us and share a lot of your passion to the public. So, Dr. J, should we just,
I think I don't know, Dr. Mukamala, whether you have any final thoughts before we
yeah,
close.
right.
Yes, no, thank you both for talking about this topic. After going through what I went through with my brain tumor, not knowing life expectancy, I consider all of these my bonus days in life. I tell people it's like a pinball game. Remember, we used to have pinball. If
Mhm,
you do really
mhm.
well with the 3 balls, you get the
You're the,
bonus ball to play with.
yes.
So this is the bonus phase of my life, and I can't think of a better way of spending these bonus days by talking about important things
Uh,
with smiling faces like you guys. So thank you.
oh,
Thank
thank
you.
you so
Oh,
much.
we
Yeah.
look forward to opportunity to see you online, see you in person, whether in Rochester, in Flint, or anywhere during the conference. Well, I really thank you for joining us.
Or
Mm-hmm.
the next lifestyle board meeting or lifestyle medicine meeting.
Medicine meeting. Yeah. That's to have
Yeah,
fun. It's always
yeah.
a fun to talk
Oh,
about
it's
that.
going to be fun, especially when I'm in the audience more than I'm on the stage. That'll be even more fun. Less stress.
I don't know.
That's,
You sounds pretty fun on
oh
stage.
yeah, you.
We'll trade places then.
Okay.
All right. So
Well, thanks for joining us on Healing Step to Wellness. I'm Dr. J,
I'm May.
guiding you toward whole person health, one step.
And one bite at a time. And thank you for tuning to us. Thank you.
See you
See you
next
next
time.
time.
Thank you.
Thank you.